And we're back live here at the Guidewell Insights Lounge. Hi everyone, my name is Kate Warnock and we're live on location at the Oliver Wyman Health Innovation Summit. I have another distinguished guest joining us here. This is Darin Gordon. Darin, welcome.
Thank you. Thanks for having me.
Well, we're happy to have you. Darin is the former director of TennCare. Let's get right into your
Sure.
questions. So STAT, if you know STAT News, recently reported on the rise of the quote-unquote bedless hospital. As more care transitions to outpatient facilities, does this create concern or opportunity for underserved populations?
Oddly enough, it can create both.
Okay.
And so think first from a concern perspective, you have traditionally seen outpatient services in the hospital helping to offset other costs that you see within the hospital system. And so to the extent you take some of those services out of a hospital, then you are probably going to see the prices rise for some of the other critical services that can only be provided in an inpatient setting. So in some cases, you could see small rural hospitals, if they're impacted, a certain degree of having too much of that outpatient service move away from the inpatient, the core of the institution, you could see some of them struggle financially, and so you may end up losing some access points. So conversely, to the extent that some of these bedless hospitals are going to be closer to some of the underserved populations in rural and frontier areas of the country and make it more convenient. I'm not under the impression, any stretch of the imagination, that they will actually be located in a rural or frontier area for economic reasons. But to the extent it's more convenient for some of those populations, then that could help improve access. Generally, the system's going through an evolutionary change, and we've been on this track for a while. You've been seeing this with the creation of some very businesses that are outpatient-centric for quite some time, being very successful. I think that trend's going to continue, so we just need to be careful as the system morphs, that we watch to make sure that some of those essential services that have to be provided still in an inpatient setting are able to adapt and still be available and accessible to the populations that we're talking about.
Absolutely. Well, I have another question. I couldn't resist asking you because, again, in the number of years that you were in your role, I thought this might be relevant for your response. HHS just approved $87 million to fund EHR investments in health centers across the United States. Why is it important that federal funds continue to flow this way?
So EHR investments are important. We'll say that. Now, to date, I think there's been some debate of whether or not the initial investments that have been put out into the broader health information exchange and EHR programs is sub-optimized, because some of the systems still aren't communicating well together.
Sure.
So I think to some extent, we all want to see us get to a better place, and we're not quite there yet. With that said, these types of investments, to the extent that it's helping some of those providers, which these were particularly geared toward, helping providers be better equipped to function in a value-based payment role and to transition as you're seeing care delivery systems evolve. You want to make sure that they're set up for success in that evolving landscape, and that's essential. So, it's a necessary tool. But to the extent you're doing those investments and culturally within those practices, folks are not really wedded to fully utilizing those systems, again, I think we're just going to see suboptimal outcomes from the investment. So it's a slow, long process trying to help folks along, as there's so much change still going throughout the healthcare system. You can't leave folks behind.
Absolutely. All right, our final question for you, Darin. The summit here is actively exploring the theme of population health that takes a more personalized and holistic approach to care. How will health policy continue to influence the success of this expanded definition of care?
Health policy is essential here. To the extent we ignore these interrelated components that are such directly correlated to a person's health and well-being, we will not see the type of care and quality of life that we'd want for our citizens. So it's essential that the policy is recognized, and you're starting to see that. States all across the country have already been looking at the value, and I won't only say states, but looking at it, there's evidence, there's good scientific evidence behind the value of medically tailored nutrition therapy. When a person's leaving a hospital, to the extent that they are able to get medically tailored nutrition therapy, they've seen a reduction in readmission rates. It's very important. Things that we hadn't thought of before. But then you can get into housing. To the extent some of the populations that we were serving in the Medicaid population, you can have challenges expecting someone to be compliant with a regimen when they don't have a place to stay.
Right.
And so, oddly enough, we're very complex organisms, and so there's a lot of factors that really influence how we live. And to the extent policy can enable this broader viewpoint, not necessarily that the healthcare system provide it, but that we look beyond the tool chest that we have in healthcare and recognize that some of the things that we can look at from a social perspective, the benefits accrue to the bottom line of the healthcare system. And so anything that the health policymakers can do to continue to broaden that perspective, broaden that view, in the end, I think is going to be beneficial to the people we serve.
And I think it's important too that events like the Oliver Wyman Health Innovation Summit, they take the top industry executives to really deeply explore these themes and really look beyond the checklist to impact population health. So that's why you're here, and we're so glad that you were invited to join the summit, because it meant you could be a guest with us. So Darin, thank you for your time. Thank you for joining us. We're going to be up soon with another interview. My name is Kate Warnock. Please keep watching.
Thank you.